Some people have had changes in behavior, hostility, agitation, depressed mood, and suicidal thoughts or actions while taking or after stopping Chantix. If you notice agitation, hostility, depression, or changes in behavior, thinking, or mood that are not typical for you, or if you develop suicidal thoughts or actions, stop taking Chantix and call your doctor right away. Talk to your doctor about any history of depression or other mental health problems, which can get worse while taking Chantix. Some people can have allergic or serious skin reactions to Chantix, some of which can be life-threatening. If you notice swelling of face, mouth, throat, or a rash, stop taking Chantix and see your doctor right away. Tell your doctor which medicines you're taking, as they may work differently when you quit smoking. Chantix dosing may be different if you have kidney problems. The most common side effect is nausea. Patients also reported trouble sleeping and vivid, unusual, or strange dreams. Until you know how Chantix may affect you, use caution when driving or operating machinery. Chantix should not be taken with other quit smoking products.
Call your doctor if you have high fever, stiff muscles, and confusion to address a possible life-threatening condition, or if you have uncontrollable muscle movements, as these could become permanent. High blood sugar has been reported with Abilify and medicines like it. In some cases, extreme high blood sugar can lead to coma or death. Other risks include decreases in white blood cells, which can be serious, dizziness upon standing, seizures, trouble swallowing, and impaired judgment or motor skills.
Use of benzoyl peroxide with Axone gel may cause your skin to temporarily turn yellow or orange at the site of application. The most common side effects with Axone gel are dryness, redness, oiliness, and peeling of treated skin.
Don't take Amatease if you've ever had a bowel obstruction or have severe diarrhea. Women of childbearing age should have a negative pregnancy test and practice effective birth control due to the potential risk to the fetus. Talk to your doctor to evaluate the risks. In clinical studies, the most common side effects were nausea, diarrhea, and headache. Tell your doctor if you experience severe diarrhea or severe nausea.
Aricept is well tolerated, but not for everyone. People at risk for stomach ulcers or who take certain other medicines should tell their doctors, because serious stomach problems such as bleeding may get worse. Some people may experience fainting, some people may have nausea, vomiting, diarrhea, bruising, or not sleep well. Some people may have muscle cramps or loss of appetite or may feel tired. In studies, these were usually mild and temporary.
Mom, do not take Balsamra if you have narcolepsy. When taking Balsamra, don't drive or operate heavy machinery until you feel fully awake. Walking, eating, driving, or engaging in other activities while asleep without remembering it the next day have been reported. Balsamra should not be taken together with alcohol. Abnormal behaviors may include aggressiveness, confusion, agitation, or hallucinations. The temporary inability to move while falling asleep or waking up and temporary leg weakness have also been reported. In depressed patients, worsening depression, including risk of suicide, may occur. Alcohol may increase these risks. Side effects include next-day drowsiness.
Do not take Belviq if you're pregnant, planning to be, or nursing. Before taking Belviq, tell your doctor if you take medicines for depression, migraines, mental problems, or a cold, as these medicines with Belviq may cause serious or life-threatening side effects. Call your doctor if you have confusion, sweating, fever, or stiff muscles. Some people taking medicines like Belviq have had heart valve problems. Call your doctor if you have trouble breathing, swelling, dizziness, fatigue, or a regular heartbeat. Don't drive or operate heavy machinery until you know how Belviq affects you. High doses may cause mental problems. Talk to your doctor if you become depressed or have thoughts of suicide. In patients with type 2 diabetes, weight loss may cause low blood sugar. Stop taking Belviq and tell your doctor if you have prolonged erections or your breasts begin to make milk or increase in size. Belviq may decrease blood cell count. Common side effects include headache, dizziness, fatigue, nausea, dry mouth, constipation, back pain, and cough.
BS is a different type of hormone that for some may increase potassium too much. So don't take BS if you have kidney, liver, or adrenal disease, because this could cause serious heart and health problems. Tell your doctor if you're on daily long-term treatment for chronic conditions like cardiovascular or inflammatory diseases. Serious risks include blood clots, stroke, and heart attack. Smoking increases these risks, especially if you're over 35, so don't smoke on BS. Don't take the pill if you've had any of these conditions, certain cancers, or could be pregnant. The pill does not protect against HIV or STDs.
Tell your doctor about all your medical conditions and medicines, and ask if your heart is healthy enough for sex. Do not take Cialis if you take nitrates for chest pain, as it may cause an unsafe drop in blood pressure. Do not drink alcohol in excess. Side effects may include headache, upset stomach, delayed backache, or muscle ache. To avoid long-term injury, get medical help right away for an erection lasting more than 4 hours. If you have any sudden decrease or loss in hearing or vision, or any allergic reactions like rash, hives, swelling of the lips, tongue, or throat, or difficulty breathing or swallowing, stop taking Cialis and get medical help right away.
One ingredient in Contrave may increase suicidal thoughts or actions in some children, teens, and young adults in the first few months. Serious side effects are mood changes like depression and mania, seizures, increased blood pressure or heart rate, liver damage, glaucoma, allergic reactions, and hypoglycemia. Not for patients with uncontrolled blood pressure, seizure history, anorexia, bulimia, drug or alcohol withdrawal, on bupropion, opioids, MAOIs, allergy to the ingredients, or pregnant. May cause nausea, constipation, headache, and vomiting.
Crestor is not for everyone, including people with liver disease. And women who are nursing, pregnant, or may become pregnant. Simple blood tests are needed to check for liver problems. Tell your doctor about other medications you're taking, or if you experience muscle pain or weakness, as that may be a sign of serious side effects.
Tell your doctor right away if your depression worsens, you have unusual changes in behavior, or thoughts of suicide. Antidepressants can increase these in children, teens, and young adults. Cymbalta is not approved for children under 18. People taking MAOIs or thyroidazine or with uncontrolled glaucoma should not take Cymbalta. Taking it with NSAID pain relievers, aspirin, or blood thinners may increase bleeding risk. Severe liver problems, some fatal, were reported. Signs include abdominal pain and yellowing of the skin or eyes. Talk with your doctor about your medicines, including those for migraine, or if you have high fever, confusion, and stiff muscles, to address a possible life-threatening condition. Tell your doctor about alcohol use, liver disease, and before you reduce or stop taking Cymbalta. Dizziness or fainting may occur upon standing. Side effects include nausea, dry mouth, and constipation.
Don't stop taking Eliquis unless your doctor tells you to, as stopping increases your risk of having a stroke. Eliquis can cause serious and, in rare cases, fatal bleeding. Don't take Eliquis if you have an artificial heart valve or abnormal bleeding. While taking Eliquis, you may bruise more easily, and it may take longer than usual for any bleeding to stop. Seek immediate medical care for sudden signs of bleeding, like unusual bruising. Eliquis may increase your bleeding risk if you take certain medicines. Tell your doctor about all planned medical or dental procedures.
Women who are pregnant must not take Entresto. It can cause harm or death to an unborn baby. Don't take Entresto with an ACE inhibitor or aliskiren. If you've had angioedema while taking an ACE or ARB medicine, don't take Entresto. The most serious side effects are angioedema, low blood pressure, kidney problems, or high potassium in your blood.
Humira can lower your ability to fight infections, including tuberculosis. Serious, sometimes fatal infections and cancers, including lymphoma, have happened, as have blood, liver, and nervous system problems, serious allergic reactions, and new or worsening heart failure. Before treatment, get tested for TB. Tell your doctor if you've been to areas where certain fungal infections are common, and if you've had TB, hepatitis B, are prone to infections, or have flu-like symptoms or sores. Don't start Humira if you have an infection.
Latuda is not for everyone. Call your doctor if you have unusual changes in mood, behaviors, or thoughts of suicide. Antidepressants can increase these in children, teens, and young adults. Elderly dementia patients taking Latuda have an increased risk of death or stroke. Call your doctor if you have fever, stiff muscles, and confusion, as these may be signs of a life-threatening reaction, or if you have uncontrollable muscle movements, as these may become permanent. High blood sugar has been reported with Latuda and medicines like it, and in some cases, extreme high blood sugar can lead to coma or death. Other risks include decreases in white blood cells, which can be fatal, dizziness upon standing, seizures, increased cholesterol, weight gain, increased prolactin levels, impairment in judgment, or trouble swallowing. Avoid grapefruit and grapefruit juice while taking Latuda. Use caution before driving or operating machinery.
Do not use Levemir if you are allergic to any of its ingredients. The most common side effect is low blood sugar, which may cause symptoms such as sweating, shakiness, confusion, and headache. Severe low blood sugar can be serious and life-threatening. Ask your doctor about alcohol use, operating machinery, or driving. Other possible side effects include injection site reactions. Tell your doctor about all medicines you take and all of your medical conditions. Check your blood sugar. Your insulin dose should not be changed without asking your doctor. Get medical help right away if you have trouble breathing, sweating, extreme drowsiness, swelling of your face, tongue, or throat, dizziness, or confusion.
It's not for everyone. Tell your doctor right away about any serious allergic reaction that causes swelling or affects breathing or skin or changes in eyesight, including blurry vision or muscle pain with fever or tired feeling. Some of the most common side effects of Lyrica are dizziness, sleepiness, weight gain, and swelling of hands and feet. Do not drink alcohol while taking Lyrica. You should not drive or operate machinery until you know how Lyrica affects